कुछ हद तक हमें टेक्नोलॉजी की ज़रूरत है जिससे हम आपको नॉर्मल शोल्डर दे पाएंगे. ऑल द स्किल्स दैट आई हैव लर्नड अदरवाइज विल डाई विथ मी.
एक यूट्यूबर्स होते हैं जिनके शोल्डर से कुछ अचानक बाहर आ जाता है एंड यू मस्ट बी द सेलिब्रिटी फॉर देम.
Somebody has to carry on the legacy.
How will I understand that I am suffering?
Those are the patients that are celebrities for me.
Hello everyone, this is Rita Haria and once again we are back with our podcast. Very important information we are going to share today and many more insights you will be getting regarding health. So today we are meeting Dr. Chintan Desai. Hello doctor. So I know him since many years and he belongs to a wonderful doctor's family. उसके बारे में हम बाद में बात करेंगे और डिटेल में, पर मैं ये ज़रूर कहना चाहूँगी कि एक डॉक्टर जो शोल्डर स्पेशलिस्ट हैं, वो मुझे अभी अभी पता चला कि कोई शोल्डर स्पेशलिस्ट भी एग्जिस्ट करता है. बिकॉज माई हस्बैंड हैड सम पेन इन हिज शोल्डर एंड वी वर हंटिंग फॉर अ डॉक्टर एंड माई फैमिली डॉक्टर टोल्ड मी, डॉक्टर वैशाल केनिया who's a family member, that you go to Dr. Chintan Desai and he is the shoulder specialist and he is the best doctor. So doctor, of course I know you since so many years, but today I would like to understand that what is a shoulder specialist. मतलब आप कितने साल पढ़ते हो और क्या क्या steps होते हैं to become a shoulder specialist?
Sure. So I started practice in Bombay when I was 34 years of age. So until 34 I was studying to become what I have become. So generally it takes 6.5 years to finish MBBS, which is graduation, which is a basic training.
Correct.
Beyond which is 3 years of residency in orthopedics. Beyond which is an optional training that you can choose to do. What I found during my training in general orthopedic training is that training is not sufficient to train you for being a specialist. Let's say a spine surgeon trains then after orthopedics to become a spine surgeon. Similarly, a knee specialist becomes a knee specialist when he spends some time doing knee patients after doing orthopedics. So in our curriculum we get trained very well for doing trauma or fracture surgeries in orthopedic training, but all these specializations are subspecialties which you are optionally can go into, depends on your interest. I was one such outstanding sort of which means not, I wouldn't say, I wouldn't boast myself to say I was an outstanding student. What I mean to say is I was an outlier in which I wanted to focus my attention more on shoulders, because during my training I realized that was a neglected joint.
Correct.
It is a joint that most specialists or orthopedic surgeons tend to ignore in terms of going into deep into the depths of what is the cause of a shoulder pain or a problem. Everything cannot be a frozen shoulder. Like any pain in the shoulder is labeled as a frozen shoulder.
Exactly.
And which is where it gets misdiagnosed and the patients then continue to have suffering.
Yeah.
There is a whole world of technologies and new ways of managing shoulder problems and pain, which we will talk through your podcast. But that was my motivation and inspiration to go into shoulder surgery, because every second friend of mine was doing knee replacements. And knee replacement has become like cataract surgery now. So
exactly.
It's a very basic surgery that, obviously there are more technical challenges in very difficult cases, but otherwise the standard knee replacement surgery is a very standard surgery and very commonly understood and known and accepted by the society. In terms of shoulders being neglected, there are very few people who are focused on treating shoulder problems, and that's where I focused my attention, and I spent 3 years after my orthopedic training in shoulders, which is when then I came back to India and then started my own shoulder practice.
So what
now
you say?
Working for nearly about 8 years in Mumbai doing shoulder work.
Wow, 8 years of experience already you have now.
Of my own, yes.
Yeah, great. But what I understand is, so I was actually thinking to ask you that the study of shoulder pain management is available in India or you have to go abroad?
There are few specialists who do shoulder surgery, but again, it's like, some of them are not good teachers, or they don't want to teach, or there are various reasons for that, and hence the best, I would say, a student has to find his mentor. So I had to I attended a lot of conferences and workshops, and also read a lot of research, and found out about who is a good shoulder surgeon that also trains students. So now I have trained 4 of my own students. So
Super.
what I have learned, I need to pass on for this.
So you
whole,
believe in imparting knowledge?
Naturally, I mean, unless knowledge is imparted, all the skills that I have learned otherwise will die with me.
Yeah.
That shouldn't be the case.
True.
Somebody has to carry on the legacy of treatment. So, or treating or understanding shoulder problems. So, which is why I have trained now 4 students, and I was very lucky to find my mentors in shoulder surgery. I had been to Portugal first, then trained in Korea, then for the longest time, for about a year and a half, I was in Australia.
Wow.
Beyond which 2 years ago I had visited US, and in America visited 6 different shoulder specialists to get some nuances as to what is different that they do, and that's how I have become what I have become.
Friends, believe me, this is called self-motivation and focused. I mean, he's so focused, and now what I feel, doctor is training others, so imparting knowledge is a great social cause. As doctor said, that shoulder was always ignored or neglected, maybe in terms of treatment. But even me, when I go for my event, doctor, I carry lot of luggage. So I really don't care. I feel shoulder है ना, सब उठा लेगा. चलो bags को डालो इधर. बाद में दर्द होता है. Ouch. So basically, what type of patients come to you more, and how do you treat them? Because I think so, जो sports person होते हैं, वैसे doctor is a great cyclist, and he goes from Mumbai to Leh Ladakh, he goes from Mumbai to Alibag, and so many places. So you yourself know, right, how to manage your shoulders and how to travel so long. So can you please guide us and just tell us that what kind of patients can approach you?
Right. So the commonest patient I see is a middle-aged woman who comes to me with recurrent shoulder pain, or becomes prolonged with time, mainly with household activities and all of those things. What I want to enforce or try to guide women from my end is, in our country, women are very much focused on their work and keeping their house tidy and clean and building their house well, but they neglect themselves, in which they don't train themselves. Their muscles become weak. Menopause is a real problem, in which once your periods stop, then your muscles go weak, and then your bones become weak, which is osteoporosis. So unless you train, unless you strengthen your body is not going to become strong on its own. Resistance training, which means strength training, is a very important part of your routine that it should be, along with cardio exercises or yoga or stretching, what you do. That is the only way your muscles will become strong, and in turn then your bones will become stronger. So it's the same as when you train your lower limbs. So let's say if you're walking or trying to go for a trek or going for a marathon or something, you practice that activity, right? So similarly, all day long you're holding things on your shoulders, and imagine your shoulders are weak. The weakened muscles then have trauma or small injuries where they can tear, and muscle tears or tendon tears in the shoulder is the commonest problem we are seeing, which we are treating with treatments and with surgery and things like that. So before you want to get into any sort of activity that you do on a routine basis, you have to learn to exercise and strengthen your upper body. So you have to spend some time training and making your body strong. That's when injuries can be prevented.
So doctor, this is out of curiosity that how will I understand that I am suffering? So of course when I get some pain, so sudden when I lift something and I may get a pain and there will be some injury, or how do we understand the symptoms, and when can we or a patient can come to you? Mm-hmm.
Okay, so not all patients need my services, to be honest. Most of the pain in the shoulder can be self-limiting and is self-managed, or can be treated with simple treatments at home. If you are having these types of problems, that is when you need to see me. One is if your shoulder is becoming stiff, which means earlier you were able to comb your hair, now you can't reach up, you have difficulty combing your hair. For women, you cannot go behind your back to do or undo your clothes. That patient, if that problem is slowly increasing for you and the pain is worsening, then that's a time that you need to see me. If that problem is self-limiting and slowly improving with ice application or anything like that. So this is a patient who does not have any injury. The pain in the shoulder came up on its own and the shoulder is becoming stiff. So those types of patients need to see me maybe after 15 days to a month if it is not improving with stretching exercises or doing simple pain medications or icing it. The second patient is if you have injured your shoulder, like let's say you fell off a bike, or you were in the gym, you lifted something heavy and then you are unable to lift your shoulder, or you find that I have weakness lifting my shoulder, that earlier I used to be able to lift 10 kgs, now I can't even lift 2 kgs. That is a patient who may have a tear in his shoulder, so a tear in the tendon. That is the patient that needs to see me sooner, faster, because these tears, once they are diagnosed, then they can be treated earlier, the recovery is better and the patient goes back to treatment faster. The third type of patient that should see me is an athlete. Like let's say you are a cricketer, you're a kabaddi player, you are very active in your sport and you had an injury and you fell and you felt your shoulder dislocate or pop out of the joint. So those patients need to see me immediately. If you have had that shoulder dislocation, I have to put it back for your shoulder to function normally and to prevent further injuries. And those are the types of patients more often than not will require some sort of surgical intervention to treat them and get back to sport earlier or faster. So any of these problems you need to see me.
डॉक्टर काफ़ी सारे आप लेक्चर्स भी देते हैं, मैंने पढ़ा, और आप लोगों को समझाते हैं, पर आपसे बात करते करते आपने कहा कि कई क्रिकेटर्स होते हैं या कोई भी एथलीट होते हैं जिनके शोल्डर से कुछ अचानक बाहर आ जाता है, द मेडिकल लैंग्वेज यू अंडरस्टैंड, बट देन आई एम श्योर यू मस्ट बी हैविंग अमेजिंग सेलिब्रिटीज़ कमिंग टू यू and you must be the celebrity for them who gives the best treatment to them.
Sure.
And you must be getting very different and challenging cases, right?
Yeah.
So can you put some insight on that?
So for me, as a doctor, the celebrity is not a film star. A film star is not a celebrity who's coming for shoulder pain, because those people can wait and have time to recover. I will operate them or treat them and they get better, they follow the exercises. But the celebrity for me is an athlete.
Yeah.
A cricketer who's playing in the state level, national level, aspiring to go to the Indian team or aspiring to go to the Olympics. That patient is the celebrity for me. That is the patient I want to focus all my attention to and make them do whatever it takes to get them back to sport as quickly as possible. A single day wasted in them causes muscle weakness and a very prolonged recovery. For them, that is career ending.
Yeah.
So those are the patients that are celebrities for me. To give you an example, recently we have operated a patient who is a female cricketer. An exceptional cricketer. I don't know how she does what she does. Two of her fingers are missing since birth, but she's an exceptional cricketer. She still bats well, and she's an inspiration in herself. She plays for the Ranji team from Vidarbha, and she's aspiring to play for the Indian cricket team.
Wow.
She is a bowler and she complained of her shoulder being painful for over a year. She had tried various types of treatments and she used to experience limitation in performance where she couldn't bowl to the speed that she would earlier be able to. So that limitation in performance is the problem in those patients that we then have to treat. So when we deep dived into her case, we found out there was a labrum or a tissue injury in her shoulder, which we then decided to repair, and she's on the road to recovery. So these are the patients that are the celebrities for me, and those are the ones that need immediate attention to make them achieve what they want to achieve or what they are capable of.
Super. So proud of you. So, sir, what I understood is post surgery or whatever treatments you give, you can go back to your normal routine easily with maybe some precautions which you have to take, because an athlete can go back to the field and do, because any athlete will work with passion. They just don't work for काम करना है या परफॉर्मेंस देना है. तो दैट्स द बेस्ट थिंग व्हाट यू गिव देम कि अपना सपना वो पूरा कर सकते हैं. पर एक चीज़ है जो सबसे ज़्यादा चैलेंजिंग है और बहुत कॉमन है, और हर एक वुमेन लाइक મને ફ્રોઝન શોલ્ડર્સ છે, मतलब मुझे फ्रोजन शोल्डर है, तो ये फ्रोजन शोल्डर कैन बी ट्रीटेड कम्प्लीटली 100%.
Yes. So frozen shoulder is just one part of shoulder pain. This is what I want people to understand. That a frozen shoulder means only the tissue in the shoulder becomes tight and there is no particular reason for it. It can be because of diabetes, because of menopause, because of thyroid problems, and the shoulder suddenly starts becoming painful and slowly starts becoming tight. The first complaint that a woman will come to me and say that I can't open up my bra. The second complaint is I can't comb my clothes. Third is then they start becoming stiff and tell that I can't raise my arm to put the clothes in the cupboard. So if you are developing tightness going behind the back, tightness moving outwards or unable to do your hair, that can be a frozen shoulder. However, there are small injuries in the shoulder also which can lead to you developing a stiff frozen shoulder, which means that if, let's say, doing household activities or doing Diwali ka saaf safai, you started with shoulder pain, that is a possibility that you have a small muscle injury or a tendon injury which is then leading to you developing a frozen shoulder. So when you come to me with pain and stiffness in your shoulder, what I have to do is confirm whether you have an injury or you don't have an injury. Accordingly, then your shoulder can be treated or become normal 100%. Unless we shoot, let's say if we shoot in the dark, like every patient goes to physiotherapy or every patient goes to surgery, they may not improve. We have to first understand what is the cause of this. So a frozen shoulder patient who does not have any injury, we confirm all of this by doing advanced imaging like MRIs, and if they don't have any injuries, those patients can resolve on their own. They only need stretching exercises and pain management in the early phases, then slowly they improve. But mind you, treating a frozen shoulder is a long process. It takes about a year on average for those patients to improve their movements. There is a specific treatment for it which is very successful, which we do only after 6 months of patients having stiffness, because a very small subset of patients need this treatment who are still stiff at 6 months after, and we are not seeing any improvement. Only those patients we do an arthroscopy, which means a keyhole surgery, just like laparoscopy in the tummy, simple words, laser surgery, and with that within a month's time these patients regain their full movements.
Wow. Okay.
So what it involves is putting in a camera in the shoulder and releasing the tight part of the tissue. Imagine that your shirt is tight and I'm opening up a few stitches of it to make it loose. Your arm becomes loose again and your movements recover. So several of these patients are the ones that then send me more patients because they see their suffering ending sooner. So pain management is very important in the early phases, and most important to understand is it can heal on its own. Only very tight, stiff patients do need then surgical intervention. The second subset of patients who have an injury, those patients definitely need us to put in a laser or an arthroscopy for those patients to repair the torn or damaged structure. Unless I repair the damaged structure, the shoulder will remain painful and stiff. So those patients are not typical frozen shoulders. So unless those patients come to me and then we have diagnosed them correctly, the treatment of shoulder pain then proceeds and then they recover normally.
वाह, हमारे कंधे हमेशा मजबूत रहें, तो इसके लिए एक गोल्डन रूल आपको हमें आज बताना है.
ओके, सो सभी ने अपने बैक मसल्स को ट्रेन करना है. The most important exercise for shoulder that you should do every day, just go today, go on Amazon or any sort of decathlon or wherever, not promoting them, but get any of those TheraBands, which is elastic bands. Just put it in your washroom, put it in the hook, and every day just do rowing exercises. If you just did rowing exercises, your back muscles will become stronger, your posture will become straight, and that will prevent you from slouching. And then any slouching movements with shoulder moving up is the main cause of you developing a tear on your shoulder or you developing a stiff shoulder. So if you just sat straight with training your back muscles and the shoulder blade muscles, that is one rule to follow to prevent any sort of shoulder injury for life.
Super. This is truly a golden rule. Thank you so much, doctor.
My pleasure.
सबका अपना एक पैशन होता है, राइट? डॉक्टर का पैशन है एक स्पोर्ट्स और दूसरा म्यूज़िक. ही प्लेज वंडरफुल गिटार एंड ही इज़ अ ग्रेट सिंगर ऑल्सो, राइट? पर उससे भी ज़्यादा मैं एक बात कहना चाहूँगी, कई लोगों का पैशन होता है फिटनेस. रोज़ जिम में जाना है, वज़न उठाना है और फिर अपने मसल्स सबको बताने हैं. पर फिर भी कई लोगों को शोल्डर में तो इंजरी आती ही आती है, मतलब दे फेस लॉट ऑफ प्रॉब्लम. So what are the common mistakes people will make, and then what precautions they have to take? Can you please guide us?
Yes. So the first thing is exactly as she said that आपका कारण जिम जाना है कि आपको मसल्स बनाने हैं और लोगों को दिखाना है, ना कि आपका फिटनेस का कारण है.
हाँ.
अगर ये कारण है तो आपको ज़रूर इंजरी हो सकती है. अगर आपका कारण है फिटनेस और प्रॉपर ट्रेनिंग तो शायद इंजरी नहीं होगी. सो इंजरी शोल्डर में क्यों होती है जिम में? बिकॉज ऑल ऑफ अस वांट टू ट्रेन एंड हैव बिग बाइसेप्स, ऑल ऑफ अस वांट टू हैव बिग पेक्टोरल मसल्स एंड हैव वाइड चेस्ट. सो वी ऑल वर्क ऑन चेस्ट हेवी थिंग्स. We only focus on bench pressing, we only focus on biceps and triceps, and we forget the poor old shoulder blade muscles. And what happens then is that your shoulders become slouched because the front muscles are heavy, the back muscles are weak, and you slouch like this. Now you imagine even in a normal person, आप आपका shoulder slouch करें and अभी आप हाथ ऊपर करके कोशिश करें कितना जा रहा है. Isn't it difficult?
Yeah.
Versus if you open up your shoulders and then raise your arm, isn't it easier?
Yeah.
So why that happens is कि normally shoulder के bones ऊपर, जो shoulder blade का bone होता है वो ऊपर होता है, और आप अगर ऐसे करें तो आपका shoulder का ball को जगह नहीं मिलती move करने के लिए. So ये patient typically जो front heavy है वो कुछ भी उठाने जाएगा, shoulder bones में वहाँ pinching होगी और muscle injuries होंगी. तो इसलिए आपने fitness के लिए आप gym जा रहे हैं, सो इक्वल अटेंशन आपने शोल्डर ब्लेड्स को देना है ताकि आपका पॉस्चर सीधा रहे. इन एक्सचेंज आपके पेक्टोरल और फ्रंट मसल्स भी ज़्यादा खुल के दिखेंगे. सो आप आपके बैक पे उतना ही फोकस करें जितना आप आपके फ्रंट पे फोकस कर रहे हैं. बैलेंस मेंटेन रखें और शोल्डर इंजरीज प्रिवेंट करें जिम में.
एजिंग इज़ अ प्रोसेस. सो नी को तकलीफ़ होती है, आर्थराइटिस आता है, तो शोल्डर को भी प्रॉब्लम तो होता ही होगा, राइट? इन सीनियर पेशेंट्स यू सी देम ऑफन.
जी. सो सबसे कॉमन पेशेंट जो सीनियर है 70 ईयर्स एंड प्लस, जिसको शोल्डर पेन आ रहा है, उनका नी रिप्लेसमेंट हो चुका है, पर शोल्डर में उन्होंने पेन को इग्नोर कर रहे हैं या प्रोलॉन्ग कर रहे हैं सोच के कि फ्रोजन शोल्डर है. पर जैसे नी घिस गए हैं वैसे शोल्डर भी घिस गए हैं उनके.
अच्छा.
तो उनको वो मूवमेंट नहीं हो रहा है क्योंकि शोल्डर घिसने की वजह से मूवमेंट नहीं है, एंड दैट इज़ शोल्डर आर्थराइटिस. और वो पेशेंट फ्रोजन शोल्डर का पेशेंट नहीं है. मतलब ये 70 प्लस एज के पेशेंट जिनको शोल्डर में पेन है, वो एक्सरसाइज या सिर्फ फिजियोथेरेपी करते रहेंगे तो दर्द बढ़ता है उनका. आपने काफ़ी सुना होगा लोगों से. सो उनका दर्द इसीलिए बढ़ रहा है क्योंकि घिस गया है खंदा. सो अभी जैसे नी रिप्लेसमेंट होता है वैसे शोल्डर भी रिप्लेस होता है. सो ये काफ़ी लोगों ने सुना भी नहीं होता है कि शोल्डर्स भी बदल सकते हैं.
Yeah, this is so surprising. Yeah.
Yes. So with advancement in technology now, just like knee replacement, shoulder replacement is also catching up and it's a reality, and patients are recovering very well after it. Just like आपका knee ठीक हो जाता है knee replacement के बाद, वैसे ही आपका shoulder में nearly normal movement आ जाता है after shoulder replacement. सो जो पेशेंट को आर्थराइटिस है या पूरा घिस गया है, एडवांस स्टेज बहुत बढ़ चुका है, उसको हम कुछ भी करके, जैसे घुटने का आर्थराइटिस रिवर्स नहीं कर सकते, केवल रिप्लेस कर सकते हैं, वैसे ही शोल्डर को हम रिप्लेस करते हैं जिससे ये पेशेंट्स फिर ठीक होते हैं. और उनका दर्द जाता है.
What kind of technology you use to replace the shoulder, and of course for other treatments also, how technology helps you?
Right. So for replacing shoulders, now the most advanced shoulder replacement is called as a reverse shoulder replacement. So why a reverse shoulder? Reverse means जहाँ पे socket है वहाँ हम ball लगाते हैं और जहाँ ball है वहाँ socket लगाते हैं. So इसको ये ball और socket joint reverse हो जाता है उसमें. ये करने की या ये innovation की या ये technology की ज़रूरत इसीलिए थी क्योंकि ये पेशेंट्स में ना तो सिर्फ उनके शोल्डर में घिसावट हो जाती है बट उनके मसल्स भी फट चुके होते हैं. सो जब मसल फट गए हैं देयर हैज़ टू बी समथिंग दैट टेक्स ओवर द फंक्शन ऑफ द मसल. सो ये रिवर्स करने से वो मसल का फंक्शन ये इम्प्लांट या मशीन टेक ओवर कर लेता है और फिर पेशेंट का हाथ नॉर्मली हिल सकता है. सो ये अब रिवर्स शोल्डर रिप्लेसमेंट करने के लिए भी काफ़ी एडवांस टेक्नोलॉजी है जिसमें हम इसको कंप्यूटर नेविगेटेड करते हैं, विच मीन्स हम पहले सीटी स्कैन करके कंप्यूटर में आपका सर्जरी जो करना है वो कंप्यूटर में पहले परफॉर्म करते हैं एग्जैक्टली फिर वो आपके लिए ऑपरेशन रूम में रेप्लिकेट करते हैं ताकि मुझे 100% पता होता है कि कितने साइज़ का कट लेना है, कौन से एंगल में कट लेना है, अंदर कितने साइज़ का मशीनरी बैठेगा. सो वो एग्जैक्टली हमें बिफोर सर्जरी ही पता चल सकता है. सो इमेजिन करिए कि आपका सर्जरी में आपकी सर्जरी करने से पहले कर रहा हूँ कंप्यूटर में. सो वो सब करने के बाद मैं आपको एक सक्सेसफुल शोल्डर दे सकता हूँ.
वाह.
सो वैसे ही बहुत सारी शोल्डर्स की ट्रीटमेंट अभी की होल प्रोसीजर से होती है, विच मीन्स लेज़र या कैमरा प्रोसीजर से, जिसमें हमें कोई बड़ा कट नहीं करना पड़ता शोल्डर पे. हम सिर्फ अंदर लेज़र या कैमरा डालते हैं, आर्थ्रोस्कोपी बोलते हैं जिससे हम आपका डिसलोकेटिंग शोल्डर रिपेयर कर सकते हैं, आपके मसल्स जो डैमेज है उसको फिक्स कर सकते हैं. सो उससे फिर आगे चल के आर्थराइटिस प्रिवेंट होता है या वेयर एंड टेयर शोल्डर में प्रिवेंट होती है और आपके मसल्स फिर से स्ट्रॉन्ग होकर आपको नॉर्मल फंक्शन दे सकता है. सो आज शोल्डर सर्जरी में टेक्नोलॉजी के बिना हम सक्सेसफुल शोल्डर सर्जरी नहीं कर सकते, ये कहना सही है कि कुछ हद तक हमें टेक्नोलॉजी की ज़रूरत है जिससे हम आपको नॉर्मल शोल्डर दे पाएंगे.
सो टेक्नोलॉजी इज़ सो इम्पोर्टेंट. एंड पहले तो न मोबाइल था, न सोशल मीडिया था और न इतनी अवेयरनेस थी. आज हम डॉक्टर के साथ हैं. डॉक्टर ने जो बातें हमें बताई हम पूरी दुनिया को एक साथ बताएंगे हमारे इंस्टाग्राम पे. तो ज़रूर देखिएगा. द वे यू हैव एक्सप्लेन्ड, नरेटेड एंड स्पेंड योर वैल्यूएबल टाइम फॉर अस. Thank you so much.
I hope this was helpful and I hope to see no one with shoulder pain to come to me.
Super. Thank
Sure.
you so much. ये है हमारा podcast with Dr. Chintan Desai Shoulders. Thank you so much once again, Doctor. Thank you.